We are excited to bring Myos to all of the handlers that are joining us tonight. As many of you know, I also do some work for Penn Vet Working Dog Center and did their conference, and that's where I met Andrea, who works for Myos, and really became familiar with their product. As most of you also know, Dina's partner, Hunter, encountered some issues with cancer that required him to have an amputation, and that really led us into a personal exploration of the product as part of supporting him and the rest of the dogs on the CFT instructor team. Since then, Myos has been joining us at some of our in-person workshops, providing one-on-one consultations with handlers, sharing information about their products. They've also generously offered search and rescue handlers a very special promotion that allows us, realizing that so many of us are volunteers and do this out of our own pocket. They wanted to be able to help support the health and well-being and muscle strength and performance of our search and rescue canine partners. So with that, I'm going to turn it over to Andrea, and she's going to introduce her team, and we hope you guys enjoy the presentation. Andrea?
Thanks, Kathleen and Dina, for doing this again with us. It's, I believe, our second year in our sponsorship with you. And as Kathleen said, we met actually during the pandemic. Kathleen was putting on the Penn Vet Working Dog Conference, remaining touched, and she was very interested in trialing the product. The same with Dina, and then Nick, their other instructor, was trying it out. And then we got the opportunity to be asked, hey, would you like to be embedded in one of our workshops in Florida, which I did over a year ago, and it was the most amazing experience I've ever had. I brought everything back to our team and believe that this area in the industry is much needed with the support of muscle health when it comes to our athletic canine working dogs. And it's been an amazing experience. I couldn't ask more from Kathleen and Dina on our partnership, so I really appreciate your time and effort in spreading the good word about Myos, because it does work. So I'm going to now turn over the baton to our CEO, Joe Manello, and I'm going to take it from there. Joe, thanks.
Great. Thank you, Andrea, and thank you, Kathleen, Indiana. Myos Corp, I'm lucky to be the CEO of, was once a human sports nutrition company, which is now 95% a animal health nutrition company, which is pretty incredible. We picked a path during the pandemic, and this path has just grown and grown and grown for us. We now have numerous clinical studies and have over 2,000 vets prescribing the product. And you know what, I couldn't be more excited about what's going to happen this evening with Dr. Schultz. I'm happy to introduce Dr. Jennifer Schultz. She graduated from NC State College of Veterinary Medicine after earning 2 undergraduate degrees in chemistry and biochemistry. Two subjects I clearly would have failed when I was in college. She started as an emergency vet, but then moved on to do what she truly loves in the field, which is canine rehab. She then started her own rehab practice and now has 3 full-time vets and 8 staff members. Dr. Schultz also treats working dogs and works with SAR canine handlers in her community. And finally, we are really lucky to have Dr. Schultz on our vet advisory board. And with that, I will hand it off to Dr. Schultz.
Thanks, Joe. I appreciate it. I'm very lucky to do what I love and work with canine handlers, not only SAR, but in a variety of other sports, and retired dogs and pet dogs as well. So super excited to be here tonight. I was introduced to Myos way back in 2018 by another board member. I think before there really was an advisory board, and started using it in my rehab practice and have loved it, and was excited to join the Myos team as an advisory board member. So hope that you guys get something out of this presentation to support your partners. And there we go. As Andrea said, we've Myos is in lots of vet clinics throughout the country. And I think just like rehab has a lot of expansion to do, there's lots more to do here. Muscle health is a new concept. On the human side, there's not a specialist at the doctorate level for muscle. On the veterinary side, it certainly comes under sports med and rehab. And so that's why we're here tonight. What I really appreciate about Myos as a company is the focus on research. It's great to see it work in our hands, but to be able to go back to a research study and say, no, it really does do this, is really important as well. So these are the studies that have come out. This is a mix of human studies, kind of proving how they had muscle gains, but also canine studies showing proof of muscle gains, and also more function in our older dogs. So we'll get a little bit more into some of these studies. And these are published in peer-reviewed journals, which is important to keep us all on the up and up about our research. So the TPLO clinical study was done at Kansas State. This is a randomized double-blind placebo-controlled study looking at how Fortitropin, which is the active ingredient in Myos, prevents muscle atrophy after TPLO surgery. So half the dogs got Fortitropin, half dogs got cheese powder, because Myos is this beautiful bright yellow orange color. And really the results of that study is that it prevents the loss of muscle mass in the leg that had surgery. We also saw some increase in weight bearing on the leg that had surgery. That wasn't clinically significant. And we think it did this because it prevented an increase in the myostatin levels in the blood. So myostatin is a muscle protein that causes muscle to not grow. And that increases in levels when the dogs aren't as active. So as you can imagine, after surgery, the dogs are restricted. They're not allowed to move around as much because the surgeons want to protect their precious work. And so when they're not moving around as much, then they're not asking for muscle contraction. And we just see this, what's called disuse atrophy. They're not weight bearing. I certainly in my practice see this translate into other types of orthopedic surgery. This is the most common surgery that your dogs might need to have for cruciate ligament rupture. But patella surgery, hip surgery, we see similar results in my hospital with other surgeries as well. So this is really exciting because sometimes the return to function or return to play is limited more so by the loss of muscle mass and muscle strength than it is the actual time to recovery from surgery. I'm not the only one who thinks this way. Dr. Knapp is boarded in sports med and rehab and surgery and uses Fortitropin quite a bit in his patients. Dr. Harkins, an internist, is also looking at, how we can use this in any patient that has a post-operative recovery period where they have to be restricted. So the other dog study that's really exciting is this quality of life and mobility study in geriatric dogs, also at Kansas State. So similar study set up, but smaller dogs, because these were older dogs. So looking at their quality of life and mobility using this validated measure called a Liverpool osteoarthritis in dogs, or LOAD. And this is an owner-reported study. So to me, what's really cool about LOAD and how we use that in research studies is that we go through at the front and have owners fill out this assessment of how their dog is functioning at home, because that's what rehab is about. How does your dog function? How do they get around? And then they track that over time. And so there was a significant improvement in LOAD scores, and that's an overall score. That's not weight bearing. It's not muscle strength. It's how is your dog doing overall and functioning and getting around. And the dogs that were on Myos had a significant improvement in their LOAD scores with no change in the placebo group. So this is not an increase in pain medication or anything like that, just their ability to get around at home and function and do what they love to do. So that's what I love about this study. So in my practice, we talked a little bit about orthopedic surgery. So TPLO for cruciate ligament disease, MPL is for luxating patella, but really any orthopedic surgery that might cause your dog to not use their leg as much. And sometimes these are necessary in our dogs. So we start Myos as soon as possible. If I see the dog at the time of injury before they actually get to the surgeon, I'll start them on Myos immediately. Certainly the study was done starting day 0, so the day of surgery. If I don't get them in rehab until, 2 weeks later, 4 weeks later, I started immediately, so that we can prevent that muscle loss and build muscle more quickly. We don't have any validated strength tests in dogs the way they do in people. So the way most rehab people do it and the way I do it in my clinic is to hold a 3-legged stand. So try to get the dog to hold still. Distraction with cookies or a toy or a bumper is a wonderful thing. And try to hold up, if we're trying to assess right hind leg strength, we're lifting the left hind leg near the ankle, trying not to let them lean on us. How long can they hold that? Normal dogs should be able to hold it about 30 seconds without any leaning on the tester or shifting position and twisting their body to try to stay there. Certainly the other thing I love about this is we're able to get them to a normal recovery and normal activity more quickly. So surgeons are normally going to recommend 8 weeks of just straight leash walks and maybe another 4 to 8 weeks of getting back to themselves. But what I find, especially in working dogs that do a job, whether it's SAR or dock diving or agility, is then we end up having to take another 8 weeks to build these dogs' muscle strength and coordination back to get them back into that return to activity, return what they were doing before. And with Myos, that cuts that 8 weeks out because we're building muscle so much more faster. We can get them into training for their sport more specifically, more quickly. And we can progress through those exercises more quickly. Certainly, we see a large number of dogs who have injuries, right? Whether that's a muscular strain or a sprain of a tendon or a ligament. And certainly, psoas strain gets a lot of talking about. Probably we don't see as many of those as we think. Shoulder tendinopathies, biceps supraspinatus, tearing the medial shoulder structures, especially in dogs that are going under uneven ground or loading their front end a lot, can help flexor tendon strains in the elbow. So it takes 6 to 9 months for a ligament and 9 to 12 months for a tendon to heal. And so these dogs often have their exercise restricted for a really prolonged period of time. It might not mean, crate rest or 5-minute walks, but not able to run and play and jump and go through those uncontrolled movements the way they normally would. So we're trying to maintain the muscle strength in these dogs when those higher intensity activities or explosive movements aren't allowed. So trying to keep their muscle mass up with isometric exercises. So standing and holding their weight on an exercise ball, doing push-ups or 2 feet up, 2 feet down exercises, whatever's needed in that specific dog's rehab plan. And again, because they're not losing muscle mass during this period of exercise restriction, then once they're cleared to work, then we can get them back to work more quickly. Because it used to be that, a tendon tear could take a dog out of whatever they were doing for their lifetime, because by the time you get them back through a rehab plan, they're never as strong as they were. The tendon itself is never as strong as it was. So if we can maintain that muscle strength, they do much better. And then our aging dog population, I think the great work at Penn Vet, Dr. Otto, has shown that dogs that are going through a strengthening program can work 2 years longer, which is huge for the investment that you guys put into training in your dogs, whether they're SAR dogs or working dogs. But we know that any dog, especially our large breed dogs, it's about older than 6.5, has a much harder time maintaining their muscular strength. It's just a function of age. It applies to us after we hit about 60. So I put dogs on Myos for any dog over 7, and I keep them on it because we know from that load study that if their muscle mass is stronger, they have a better quality of life. The muscle strength seems to directly apply there. So especially in our big dogs, they need to be able to get up and down and maintain that independent mobility. A lot of these dogs are quite independent. They don't want to be helped. We know that if there's other health conditions like osteoarthritis, you could have pain that makes them not use a leg as well. And that may be existing right alongside their normal loss of muscle tone that happens related to age. And so even double reasons why Myos is helpful in those dogs. There was a big, what they call a meta-analysis study. So a study looking at lots of other studies that came out back in 2016. 70 to 80% of large breed dogs were euthanized due to mobility issues, which is insane, right? Not cancer, not bloat, not heart disease. And to me, if we can keep their muscle mass and strength, then we can help bring that number down, because I never want to make that decision on a dog just because they can't get up and do what they love to do anymore. So really what we're talking about is with osteoarthritis, there's this concept of multimodal management. And we know the 5 things that are included in that are controlled exercise, a lean body weight, joint supplements and omega-3s, use of Adequan, which is a disease-modifying osteoarthritic agent, and then anti-inflammatories. So that would be Rimadyl, Galliprant, that sort of thing. But really what we're talking about here is that if muscle health can improve load scores by itself, then really Myos, because that's the only muscle supplement I know of, should be right alongside that in helping our keeping dogs moving and active, and right alongside what we should be recommending early in the process for osteoarthritis. So not when we see changes on x-rays, let's get them as early as possible. And Dr. Jaffe, who's a leading expert in osteoarthritis, agrees with that. So yes, joint supplements help maintain joint health. They can decrease in inflammation. They can provide the building blocks for joint health, but the joint has to be supported by strong muscles to stabilize the joint, to support that joint and to take that joint through a range of motion. Joints die without a range of motion. So you won't keep your cartilage healthy without movement. Those strong muscles also reduce strain on tendons and bones, so we can reduce risk of injury through proper conditioning and proper strengthening. Muscles help to absorb shock during activity. And if you have a weak dog, or I should say a poorly conditioned dog, maybe a dog that's not as strong in their front end, you're going to see more strain on that. I see a lot of dogs who don't have proper conditioning for core strength, come down wrong off a jump, or take a wrong step on a trail, and their core is not able to support them. So by making sure that we're keeping them strong there, we're reducing the risk of psoas strains as well. These are everybody on the advisory board. Ria Acciani is who introduced me to this product. I couldn't be more grateful to her. Dr. Ahn is fantastic, pushing us through some strategic things there, but really a good mix of nutritionists and internists, and Dr. McCauley is a fantastic resource as far as being in rehab now for almost 30 years, and moved to North Carolina. So there's a bunch of us in North Carolina. I don't know how that happened, but it's a great team. If you're looking at the ingredients on the K9 muscle formula, so you're getting your the 3 grams of Fortitropin per serving. The vet strength also has BCAA, so branched chain amino acids. And what I like about those in the vet strength formula is that you're really providing the building blocks to be able to add that muscle, easily digestible amino acids to be able to add that muscle strength. Dogs cannot make branched chain amino acids, so this is just a way to make sure that we can do that. You do have to work with your vet to get the vet strength formula, but I mean, I think it's straightforward enough. We certainly, want to make sure you have all the resources you need to support your partners. And this, there's always, I think it's great that we can get this really nutrient breakdown. I get that question from clients a lot. When you're looking at a serving, really how many calories are added into those diets. So you have all that information and you can compare it. What I often find, because of the other vitamins that are in this, is that some of my clients that are using multivitamin actually take that out of their diet, which is just a nice side benefit. And the dose is different depending on the size of your pet. I've never seen anyone get it to 3 years opened, but someone might be leaving it on the shelf. And then this is the original formula that is over the counter. So it doesn't have those branched chain amino acids, but looks essentially the same. and the dosing is much the same, a little bit lower in calories because of the not having the amino acids in there, but the same dosing. So when we look at benefits, why do we like this product? More muscle mass, more muscle health from Fortitropin, recovering from injuries more quickly, not having as much muscular atrophy if they're not using that limb as well for whatever reason, and really improving their quality of life and mobility, which is all any of us want. I love that this is supported by the scientific research on this product. That longevity is proportional muscle mass. That's what we saw from some of the CAT studies. And I would say also from that LOAD study, when we know that muscle mass has a decrease, when there's more muscle mass, we have less death in our patients, and really can keep these dogs active and moving for much longer than they would otherwise. This is the special that Kathleen and Andrea were talking about. I think it's fantastic that the company is doing this because we all know there's always unexpected costs with our dogs. So we really want to keep these dogs working and strong for as long as possible. And Andrea has been great in helping me get this for my patients for so long. Oops, sorry. So that's showing you the bucket, which if you have multiple dogs is a great savings just in and of itself as well. And this is from Kathleen. So I think her words speak for herself, and her involvement with the company and supporting this and bringing this to you guys. And this is from Dina, and I'll stay here. I think it's amazing that we can support our dogs through so many diagnoses that are quite aggressive, and keeping them happy and moving. This is why I got into rehab. You know, I had 4 big dogs over the age of 12. I had 5 orthopedic surgeries between the 4 of them. I would have loved to have had Myos then, but there's such an enhancement to our lives, and this is why we do it. It's the partnership with them. So anything we can do to keep them with you guys and make them much better, to me is really important. So just in summary, I really feel like we can use Myos throughout our pet's lifespan to keep them moving and supported. So whether that's preventative and prolonging their quality of life and starting it when they're young, supporting them through injuries to the joints if they have surgery, if they're not surgery when they're limited, using it on our senior or geriatric patients to keep them moving, even safe in kidney disease, which is amazing. And then certainly supporting our working and sporting dogs so that they can keep training with less rate of injuries and faster recovery after movement or more intense exercises. Your dogs, you know, are not necessarily having the same day-to-day life. So I think that using Myos, seeing the research, using our patients is going to help us keep your dogs moving, having stronger muscles to do their work, and also to have a lot of fun outside of work, because all work and no play is not any fun either. Here's everyone's contact information. I'm really happy to answer any questions that you guys might have about the product or specific cases. I can't obviously make medical recommendations if I haven't seen your dog, but as far as, you know, what other things you might be using with this product or how you use it, I'd be happy to answer any questions.
So Kathleen, if I can say something, if there are no questions, just some typical questions we do get, if you would like.
Sure. We have one question that came
Great.
in. Let me pop that out there to Dr. Schultz, and then I think everybody would love to hear some of the other common things that come out from the working dog industry. This question, Dr. Schultz, was if we have a younger canine around 3 years old, how would we go about getting the vet version, and what justification would there be? And so I think the question is then vet or regular formula and access to which one you recommend.
Yeah, so I see mostly referrals, right? So You know, any patient that I see in my practice, we start this, but I also work with a lot of the general practitioners in our area that might, you know, you're going to need a relationship with your vet for your vaccinations and regular work. And so I absolutely have patients that the regular vet calls me, someone that refers me cases, and say, hey, I have this dog. What do you think about this product? And I say, yeah, I think it would be great for your pet. And I just keep that notification in our records from your regular vet that you can get it. Since I know not everybody stocks this, I will also say that this the company has worked really hard to have partnerships. So this is available through regular veterinary distributors. So this is also a great way for you to talk to your vet and say, hey, I would love to have this product. We would love to get it from you. I have this resource you could reach out to, because I'm happy to answer. I answer questions from vets all over the country. So they can talk about whether they might want to carry it in that hospital. They don't have to have a big order or anything like that. So I think either of those would be reasonable. I have clients that travel all over, so I ship this all over as well. So I think there's things there, but I would start with a discussion with your regular vet. As far as justification, I think any dog that works should be supporting this. I mean, I take the human project of this. I started a long time ago. I think that as far as justification, to me, these dogs are athletes. If you look at any athlete on a pro sports team, they're supported by physical therapists. They're doing things for their muscle health every day. So to me, just their job in and of itself is enough justification. There are some insurance companies who are starting to cover supplements as long as they're recommended by a veterinarian. And I think that, you know, the research out there is there to support. You just need a partner in your primary veterinarian.
Joe, you mentioned you had some questions that you hear pop up a lot while we wait for other handlers to send in their own questions. Why don't you share some of those with us?
Sure. Dr. Schultz, what is the relationship to stamina and muscle? Is there a relationship?
Yeah, so muscle has multiple types of fibers, but certainly you have to have that muscle strength to be able to exercise, walk, run, whatever, for a long period of time. I think certainly that my SAR handlers noticed a big difference in endurance on their dogs, or stamina, as far as how long they were able to keep going during a search without showing signs of fatigue or needing to stop. As well as not being as quiet or showing any soreness the next day. And so, you know, that's something that's difficult for me to see in the hospital, but is absolutely something that my handlers have commented on. So I think, you know, you always want to train for the types of activity you're doing as well as cross training. But Myos to me has made it easier for my patients to keep going and keep moving beyond even what their handlers realized was possible before.
Great. Kathleen, one other question comes up is if the dog cannot, for some reason, digestively has an issue with it. And there's a rare time, but every so often we find a dog that cannot take it. I don't know if that's a egg allergy or what it is. What we have found, though, is if you give it, you do a half a dose or a quarter dose and then work your way up for a couple of weeks, it seems to work. So that's what, almost like not a load, like a less of a load, but that's what we have found that's working. That question does come up.
Yeah, I would say that, you know, we use a lot of other joint supplements and omega-3 fatty acids in our practice as well. But with Myos, we saw less dogs that either didn't eat it because they didn't like it, or that had diarrhea. That would be the most common one. With some of the other supplements that are used, I haven't seen that with Myos. I think part of it's the powder. I really like that it's a powder rather than a liquid. It sounds like a little thing, but it seems to make a difference. But the dogs really like to eat it. But yeah, I mean, that sort of, you're just kind of exposing them to a little bit of that at a time. I have like 2 patients with egg allergies who didn't tolerate it, but I have way more patients that came in were on a specific diet, were told that their dog was allergic, but we were able to, start them off slow on the Myos, and they're able to take it successfully. So it's all about, how does that dog react to it? But eggs are really highly digestible protein. And so most dogs seem to be okay with it.
Great, thank you.
So I think that just from talks I've heard you guys give before, really an egg allergy is the only contraindication in terms of a dog potentially taking the product. And it sounds like some were even able to slowly introduce it without any fallout.
That's correct.
Yeah.
No, I can answer any questions about the process we go through. I can't answer any questions about the science. So if there are other questions, we do process this. It goes through numerous, by the time it reaches our dogs, our pets, it's probably gone through 6 tests to make sure that no listeria, no salmonella, etc. We test all the time, and we rarely, if and have ever had any issues because of that, other than a dog with an allergy. And this is the same product that goes into humans that humans take, and I take. So, and my dogs take.
I don't see any other questions at this time. I'll turn it over to Dina. If anybody does have any questions that pop up after the webinar ends, feel free to email us and we'll make sure and pass that up to the Myos team as well.
Well, first I want to thank Jennifer and Andrea and Joe for taking some time tonight to talk to us about Myos and the product and some of the research studies that have been done to support the product and how it helps our dogs. You saw my statement there during the slideshow about Hunter. I'm really fortunate to be able to tell you he turned 11 last week. And when he got diagnosed with osteosarcoma, he was 9, and I didn't think that he'd make it to 10. I started the product very shortly after the diagnosis. Kathleen had, as she mentioned, met Andrea through her work at Penn, and I put him on it with the blessing of the oncologist that I was working with, and he tolerated it very well all through his surgery and his chemo treatments. And it's one thing that I do that is part of a whole plan for him. He worked from the time he came home at 8 weeks old, and my deal with my working dogs is you do things for me that ordinary dogs don't, and I'll do whatever I have to do to give you the best care and longest, healthiest life that I can. And I feel like for Hunter, it's definitely made a difference for him. Right now, 3 of the 4 dogs at the house are on it. Gibbs is also going to be retiring in the spring. He's on the vet strength as well as Hunter. And then Indy, who just turned 4 2 weeks ago, is on the regular strength. And it's definitely something that's easier for me to see in my older dogs, and the benefits of it. And I feel like with Indy on the regular strength, it's part of an insurance policy for him. We ask so many things physically of these dogs that I want to give him the best chance to recover quickly after a hard workout or a hard search. I want him to know, I want to know that if he is injured, that he's in the best shape possible ahead of time so that he recovers quicker and can go back to work sooner. So I'm a believer in the product. I'm fortunate to have this relationship. I talked to Andrea this week. She got me my next shipment. It arrived today back at the house. I'm going to start the 90-day trial for myself with the human product. I'm excited for it. But really, if anybody has questions for Kathleen or I, or even Nick about our use of the product and why we feel strongly about it, please reach out to us. And reach out to the Myos team if you have questions specific about the product or the research behind it, because I know that they're always willing to answer your questions. So once again, thank you all for taking some time this evening. We greatly appreciate the continued support and the relationship.
Thank you.
One
Thank you.
One more quick question just popped up before we say goodbye. I hate to miss the opportunity for this handler. They asked, when is the best time after a workout to give it to the canine? And I didn't know if you guys had any comment on the time that it's given, or if it's throughout the day, or if it's just that it's given daily as part of the dog's regimen.
Yeah, I don't use it like as a recovery. I know a lot of us use products with our dogs to help them recover and replace glycogen and glucose stores. And this is more long-term, so I don't think it matters. I do think it's easier to give with a meal, better with a meal. That's how I tend to give it, rather than have a couple owners who like to give it as a snack for whatever reason. So I don't think it's necessarily tied to your workout, other than because we're normally giving it with food, I would make sure that they were fully cooled down before you do it, especially if they were working for a long time and they had an elevated body temperature, because they're going to digest better. But I don't think that you need to give it at a specific time after a workout or in their day. I have owners that give it morning, night, not an issue.
Well, thank you guys, everybody from Myos. Thank you for coming and sharing your knowledge. Thank you, Dr. Schultz, Andrea, and Joe, for sure. And thank you, handlers, for taking the time to learn more about ways that you can support your canine partner in being the best asset they can be now, and having the best longevity of career and health that you can give them. Again, the recording will be sent out to you guys as soon as Zoom processes it. So by the end of tomorrow. And if you have any questions, don't hesitate to reach out. And if you're interested in exploring that 90-day trial price that they offer, there is also a continued discount for STAR handlers if you do decide that the product works for you. But that 90-day trial is really set up so that you can try the product and see for yourself if it's a good fit for you. Definitely reach out to the representative in your state, and they'll be able to hook you up.
Thank you all.
Thank you, everybody.
Have a great night.
Everyone. Have a good night.
Be well, everyone.
Bye-bye.
Bye.